While I make every effort to broadcast correct information, I'm also still learning. I will double check all my facts, but realize that healthcare is a constantly changing science and art. One doctor or healthcare provider may have a different way of doing things from another. I welcome any comments, suggestions, or correction of errors. I take no money from supplement or device companies. By listening to this podcast or reading this blog, you agree not to use this podcast or blog as medical advice or to treat any medical condition in either yourself or others, including but not limited to patients that you are treating. Consult your healthcare provider for any medical issues that you may be having. This entire disclaimer also applies to any guests or contributors to the podcast or the website. Under no circumstances shall any guests or contributors to the podcast or blog or any employees, associates, or affiliates of the Boss Body podcast be responsible for damages arising from use of the podcast or the blog. This blog or podcast should not be used in any legal capacity whatsoever, including but not limited to establishing the standard of care in a legal sense or as a basis for expert witness testimony. No guarantee is given regarding the accuracy of any statements or opinions made on the podcast or the blog. What's up, guys? It's Dr. Tim Jackson with another episode of the Boss Body Podcast. Brain health. Our brains are bombarded with so much information, so many stimuli in today's world, in today's society. That's why things like float tanks exist. However, we can't live in a float tank, so we have to find other methods and therapies to optimize our cognition and brain health. And so I brought in a neurophysiologist and brain health expert, Mr. Toby Pasman. Welcome to the show, Toby.
Thank you so much for having me on, Tim. I totally would live in a float tank if I could, but unfortunately, I guess that's not an option yet. So here we are.
Yeah, I mean, I would have an IV drip of glutathione in one arm and methylene blue, maybe ketamine if we could, but we're not quite there yet. So tell us a little bit about, I know you did research in undergrad. Tell us a little bit about that. What got you interested in optimizing your own cognitive prowess and optimizing brain health? Because a lot of times we think, oh, I have anxiety, it's genetic. I need to take a benzodiazepine, or people are drinking a bottle of wine every night or 4 glasses of wine every night, and it's screwing up their hormones, making them estrogen dominant. That makes them more anxious. That takes the thyroid, and then it's just a vicious cycle. So tell us about that.
Right. So I really became, I guess taking it back to childhood, there were different members of my family who suffered from different mental health conditions. And I actually lost a close family member to suicide when I was a young kid. So it actually, from a young age, I think there was always the recognition of just the importance of mental health and sort of the inefficacy of a lot of traditional mental health treatments out there. And also just witnessing firsthand, some of the devastating effects that can occur when someone's mental health gets so out of hand that it, leads to that. So really then fast forward to when I was in undergrad, I started taking some psychology classes, which I found really interesting, but psychology was a bit too theoretical for me. I think I always really liked having data, having, the hard science and numbers. So that's why biopsychology, of course, that I took really appealed to me, because it was really, it was understanding how the brain actually functions on an electrical and chemical level, and learning that we can actually measure the electrical activity of the brain with a test called an EEG. When I found out about that, that's when I started working at the research lab and going through, we were basically doing some different experiments. The project I was working on was called the Emotions and Neuroplasticity Project. So we were measuring EEG, which is brainwave data, along with HRV, heart rate variability, for people listening, a measure of kind of your autonomic arousal, your ability to handle and manage stress. So we were measuring those physiological markers as people were getting taken through this computerized task, measuring their generosity. So whether they were choosing to either give or take money from this fictitious charity in a variety of different scenarios, we're assessing the physiological data and seeing what was changing. And I thought it was super interesting. I liked the experience I got from the research lab, but I became a lot more interested in, once, we were just doing the measurement, we weren't actually helping improve heart rate variability or helping improve brainwave activity. We were just recording what someone's body was and brain was already doing. So that curiosity of, understanding, neuroplasticity, that the brain can change given the right input, and wanting to see really what was what was possible in that regard, then led me to end up working at a facility, a peak performance center outside of Seattle, which was like this meditation meets neurofeedback intensive. So neurofeedback being a training modality to actually, where you hook electrodes up to your head and actually teach your brain how to produce healthier brainwave frequencies. And has efficacy for conditions ranging from anxiety to depression, PTSD, insomnia. And then also, as I was seeing, peak performance, a lot of professional athletes, I believe Tom Brady and Minnesota Viking quarterback Kirk Cousins have talked about neurofeedback. There's different Olympians who've talked about utilizing neurofeedback. So it's used a lot in peak performance as well as clinical mental health, and even some neurologists use it. I worked for a neurologist for a little while who was using it to treat stroke recovery as well as traumatic brain injury. So there's kind of a wide array of different conditions and things that neurofeedback can improve, but it basically runs on the premise that you can first measure the brain waves that are going on, and then actually teach your brain how to produce healthier brainwave patterns through the use of this feedback.
Awesome. Well, thanks for that thorough answer. I am definitely not the expert that you are in neurophysiology. I know a good bit about it, but not, using the device and interpreting the QEEG. But, it seems to me from what I've experienced over the past 12 years clinically that, there's a lot of devices out there, a lot of machines. I've seen psychologists and therapists, have like essentially a game on a screen, and you have to do different tasks. Which ones are legit or the most legit? And I know this is a broad question, but also what's the difference between biofeedback and neurofeedback?
So to answer the latter question first, so biofeedback encompasses, so neurofeedback falls under the category of biofeedback. Biofeedback could also include things like, improving your heart rate variability, doing heart rate variability training, also some like skin temperature training where you can actually, kind of teach your body to respond different physiologically to different condition or to different stimuli. So neurofeedback being kind of a subset of biofeedback. And then as far as, man, there's so many different divided camps as far as neurofeedback goes. So it depends who you talk to. They'll tell you that their method of neurofeedback is the best, that nothing else works. I've witnessed and seen a variety of different types of neurofeedback and heard a variety of different things, where people are debating what is the best style of neurofeedback. You can do what's called Z-score training, which kind of trains someone based on a relative database. So other people, age and gender matched. So there's sort of a limitation with that where it's like, maybe we don't necessarily want to make someone normal, because what
Right.
is a quote unquote, normal brain, right?
Right.
So like peak performance, that might not necessarily be ideal, but for something, where people are having severe anxiety, Z-score training could be a helpful choice. And then you can also do what's called amplitude training, which is where you train, a specific brainwave to just have greater power. So for the strength of that brainwave to be more. So for someone, wanting to improve their anxiety, to focus on relaxation, alpha waves are really important one just for calming down someone's stress response. So you can do direct training to enhance the power or strength of those alpha waves. But in general, there's different systems and then different things you can be doing during a neurofeedback session. The main thing is we just need to have, when someone's eyes are open, if they're doing eyes open training, you need to have both auditory and visual feedback. So that's why someone could be watching a movie where the screen is maybe fading in and out and the audio is going, from quiet to louder. And that's giving someone feedback when the audio is loud and the screen is clear. That's telling their brain, that's giving them the positive reward, telling their brain, good job, keep doing what it is that you're doing to get this reward. And then when their brain deviates from that healthy pattern, the audio will get quiet and the screen kind of fades to darkness. So it's providing real-time feedback within 100 milliseconds. So quicker than our conscious mind can even process information, telling the brain exactly when it's doing well versus when it needs to self-adjust. And there's also different forms of neurofeedback where you can play video games where you're flying like a rocket ship or spaceship on the screen, and you're controlling that with your brain waves. And then you can also do eyes closed training if you're doing more so relaxation training or getting into deep meditative training states where you're just getting the auditory feedback. So you're just listening to tones that you're trying to boost the volume, and you're not actually, seeing anything on the screen. So I know it can be confusing for people when most people haven't even heard of neurofeedback to begin with, and then they see all of these different systems and ways of doing neurofeedback training. I think it can be pretty overwhelming. But to answer your question concisely, I'd say that in general, all these neurofeedback systems in general do have benefits. Some people can respond better to one training methodology versus another. What I will say is that it's really important for anyone listening who decides to get neurofeedback training is that you find someone that is both board certified in QEEG for brain mapping and then also in neurofeedback. Because basically, if you do neurofeedback training without an initial brain map, it's a bit like shooting in the dark. You could train someone to produce more beta waves to focus and concentrate, but they might actually already have too many beta waves. So there's actually a post I just posted on Instagram about this NBA player, Chris Kaman. He was a former star for the LA Clippers, and he talked about he did neurofeedback and benefited a lot from neurofeedback training while he was in the league. And the clinician who did the neurofeedback on him, when he initially came in, he had been misdiagnosed really with ADHD, which is usually shown with an excess of the slower theta brain waves. And he actually had a very opposite pattern. He had excess of the faster beta waves. So his treatment approach was completely different based on that initial brain map. If he was trained just based on his symptoms, the neurofeedback protocol likely would have actually made his symptoms worse. So I'd say regardless of the methodology for the neurofeedback, it's super, super important to start with the brain scan. And then you can also track your progress so you can see, is the neurofeedback actually working for each person's brain by reassessing. And, it's a very data-driven process. You don't have to rely on subjective measures and, experiences, even though that can be really valuable. But I think, again, when you just provide the actual data and show people, here's how your brain was when you first came in, here were the areas where we're training, and now here's how those areas are now functioning better. It really encourages people and shows them that their brain really can change.
Yeah, and so the machine or device that you use, what are you having clients do while they're being trained?
So I've started working a lot with remote neurofeedback, where I directly ship people a device that hooks up via Bluetooth to an app. And then while they're doing the sessions, they can either play one of those video games where they're like flying a spaceship, or there's like a UFO games. There's different video games. People can also just be watching Netflix or Hulu. So it really is just dependent on, as long as there's some way for someone to get both audio and visual feedback. So if they're watching a movie, playing a video game, whatever it might be, or if they're doing eyes closed training, they can listen to something on Spotify or just music that's playing off their phone. We just need a way to actually tell their brain when it's doing well versus when it needs to adjust. And the way we do that is through varying, the audio, having louder and quieter tones. And then also, if it's an eyes open protocol, varying the clarity of the screen. Or if they're playing a video game, when they're doing better, their character will run faster or fly higher. And then when they're not doing as well, it'll slow down or fly lower. So that's kind of, there's different options.
And does it require active engagement on the client's part?
It's a great question that everyone asks me, and the answer, in short, is not necessarily, because neurofeedback is giving someone feedback within 100 milliseconds, so it's actually quicker than our conscious mind can even process information. So I tell people just to have a soft focus on the screen, and their brain will figure out what it needs to do to get the reward. So in general, it's important that someone is doing a game or watching a movie that is somewhat engaging. They don't, we don't want them to be completely bored out of their mind. But in general, you just focus on the screen, and gradually over time, your brain figures out, what it's getting rewarded for, what states it's getting rewarded for, and then it'll start producing more and more of that brainwave based on the principle of operant conditioning, of giving the brain a reward when it's doing well and taking that reward away when it's not.
Absolutely. And so one question I have is in terms of neurotransmitters. So I do urine metabolite testing through organic acids. And, we look at HVA, MVA, 5-HIAA. So can you do neurofeedback and improve neurotransmitter levels, or do you need to better balance out your neurotransmitters to receive the benefits of neurofeedback?
Hmm. That actually is a great question. So the neurotransmitters will definitely fluctuate kind of in rhythm with the brain waves. When someone's in more of a heightened state of alertness, they'll generally be producing more beta brainwave patterns along with more norepinephrine, cortisol, adrenaline, right? More stimulating neurotransmitters. And then
Mhm.
when someone sinks into a slower brainwave pattern like alpha or theta, generally there's a ramp up of serotonin and endorphins. So there is some correlation there between the neurotransmitters and the brain waves. It was just as you were saying that, it gave me the idea. It would be super interesting, actually doing some measurements of someone's urine metabolites of the neurotransmitters as they were going through neurofeedback and seeing what was changing. But I think oftentimes, like, I'll work with clients kind of on a more holistic basis as far as brain optimization, where they're not just doing neurofeedback. So I
Okay.
think neurofeedback can work so much better when someone is eating a brain healthy diet. They're, making sure that they're getting good healthy fats along with the proper amino acids that their brain actually needs to form the different neurotransmitters and the vitamin and mineral cofactors that's involved in that. So I think that's oftentimes one of the rate limiting factors for people's results with neurofeedback is there's either a lot of neural inflammation or there's vitamin and mineral and amino acid deficiencies where their brain just doesn't have the raw material. So it's just not even, you're not, it's just, I like to think of it like weight training, right? If you're trying to get in great physical shape, and it doesn't matter, like if you're working out super hard at the gym but you're getting terrible quality sleep and you're eating a crappy diet, there's only so far you're going to get training your body. You're not going to get the same results as you would if you were eating really clean and getting great sleep. So I think when it comes to training the brain, it's similar, that you really need to be addressing, the nutritional and, kind of the amino acid profile, like you're talking about with the neurotransmitters, in addition to optimizing the brain waves.
Absolutely. I was talking not on a podcast interview, but just on a phone appointment with a neurophysiologist several years ago. And he's done some work with Dr. Klinghardt. And we were talking about neurotropic viruses that activate the microglial cells in the brain, leading to neuroinflammation, things like mold toxicity, which decreases blood flow to the frontal lobe. And he said, honestly, I'll send people to you. You take care of these areas, then send them back to me to do the neurofeedback, and then it's going to make us both look better.
Yeah, I totally agree with that approach. I mean, I tell people that neurofeedback is a tool in your brain health toolkit. It's not, I never tell people it's the be all end all. It's a really powerful tool, but when you stack it with, what you're doing, exercise, all these other things, it's just going to, as you're saying, make everyone look better because the results are just going to compound.
Yeah, and if my elbow was inflamed, we could see it, and we would say, okay, no, overhead pressing, no bicep curls, no chin ups. But if your brain's inflamed, you might have anxiety, depression, insomnia, correct?
Exactly, exactly. And there's a lot of research now where, the whole serotonin hypothesis of depression, where they used to think that it was just from, low levels of serotonin were causing depression, and that's why SSRI antidepressants were on the market. But now that's sort of there's we've realized that there's more complexity to that issue. There's a lot, for some people, it could be low levels of serotonin contributing to their mood issues, but it could also be things like neural inflammation. There was actually an amazing book that came out earlier this year called Brain Energy, written by a Harvard psychiatrist. Yeah, you read the
Dr.
book?
Chris Palmer?
Chris Palmer, exactly. So, like, tying together, for people who haven't read it, I highly, highly recommend this book. Basically, tying together how all these different mental health disorders, ADHD, PTSD, traumatic brain injury, all neurological disorders too, how it all goes back to issues as far as metabolic issues within the brain. So the mitochondria, the parts of our cells that generate energy, they're, not generating sufficient energy, or sometimes in certain areas overproducing energy. So, that just on a cellular energy component, that being a whole, big cause of depression and other mental health conditions. So I think that, it's a great oversimplification to just say that serotonin issues cause depression. So I think there's so much more to it, and things like, mold, like you mentioned before. I've worked with several clients, and actually I went through some mold toxicity my freshman year of college. I started having nosebleeds, brain fog, my hair actually started falling out. I couldn't focus in any of my classes, and I went to all these different doctors and didn't have any answers, was put on different medications. And then, funny enough, like the first few days after I moved back to my mom's house after moving out of the dorms, I felt like 75-80% of my symptoms went away. So I realized at that point it was environmental. So I was kind of shown firsthand how, just that exposure to mold, I mean, I felt like a different person. I like cognitively, I was so messed up from that. So I think there really are so many contributing factors to why someone's mental health or brain performance isn't at the level that it once was.
Yeah, if you look at brain scans of people with MS or the diagnosis of MS, people with mold toxicity, and I cover up the labels, you can't tell the difference. And so, it can create white matter lesions. People say, oh, no, I definitely have MS. It's not mold toxicity because I have white matter lesions. And I'll say, okay, but what's causing the white matter lesions? And, and a small percentage of people, it may be true that we don't know. But in a lot of people, Epstein-Barr, HHV6, mycoplasma, Lyme, mold, heavy metals, all of those things contribute. So, we've talked a little bit about alpha waves, beta waves. Can you touch and give sort of a 30,000-foot overview of the different types of waves and what they're generally associated with? I know there's overlap.
Definitely, definitely. So, kind of going from slowest to fastest. So there's five major brain waves. The slowest of the brain waves is one called delta. Delta is seen mostly in really deep restorative sleep. But interestingly, it's actually one that, when we see a lot of delta in an awake state, that's actually often an indicator of neural inflammation, or actually white matter damage, where we'll see areas of the brain that are producing a lot of waking delta. That's often a sign that someone's had a past head injury, or they're dealing with some kind of toxicity, whether that's heavy metals, mold, nutritional, inflammation issues. But oftentimes, we want to see a lot of delta when someone's deeply asleep. If we see that in an awake state, that's definitely not a good thing. And then theta waves, theta is the next one up, a little bit faster than delta, but still a very slow brainwave that's associated with kind of more light sleep or deep meditation. It's kind of the state that, you mentioned float tanks earlier. So they say that floating will take you into sort of a theta state. So theta is kind of almost a hypnotic kind of bridge between the conscious and unconscious mind, where maybe we're just about to fall asleep, but kind of in that twilight stage. So it's one that oftentimes we'll see people with ADHD will have way too much theta. That's actually the FDA has a clinical biomarker where if someone has greater than 3 to 1 theta waves compared to beta waves. That's called the theta to beta ratio. It was really popularized by a neurofeedback expert, Dr. Joel Lubar, who found that kids with greater than 3-to-1 theta to beta waves almost always there's like a 90% prediction of success that they actually had ADHD. So that's oftentimes one that we're actually working to reduce excess theta waves with neurofeedback training. And then we have alpha, which is sort of right in the middle. Alpha is a calm, relaxed, idling rhythm of the brain. So drinking alcohol or smoking weed will generally increase alpha waves in the brain, kind of leading to that buzzed kind of relaxed effect. Also, alpha kind of in flow states are kind of right at that alpha theta border. So when people are completely absorbed in the present moment, whatever it is, the task at hand, their brain decelerates from the normal beta brainwave pattern that most of us are in to down into like an alpha theta state where we're completely immersed in the present moment, and something called hypo or transient hypofrontality occurs. So a period of time, the frontal cortex actually goes kind of offline. There's decreased blood flow to that area that's very involved in sort of that judgment, the self-critical voice where we're constantly evaluating and judging our action. So that voice sort of shuts off and we're able to just be completely immersed in the task at hand, and that's known as a flow state. So that's alpha, and then beta is just our normal alert, awake consciousness. So most of us just listening to this conversation or us having this interaction right now, Tim, most of us are producing beta waves. And beta is one that oftentimes people will run into issues with when they have overproduction, particularly a subset of beta. So beta is basically, it's a pretty wide frequency range. So anywhere from 30 up to 30 cycles per second. So these frequencies are all measured in hertz. So how many cycles per second they're occurring. Beta, there's a pretty wide range, and generally the high beta frequencies, so anything above 20 hertz is considered high beta. And that when people are having a lot of high beta, that is a very good indicator that they have anxiety, worry, ruminating thoughts, sometimes obsessive compulsive disorder, along with issues with insomnia, with their sleep. It's kind of a very common issue that's found on someone's brain scan where they have overproduction of high beta, and it's very much linked to that kind of chronic stress response, that fight or flight feeling or state that a lot of people are stuck in. So that's beta. And then lastly we have gamma. Gamma is the fastest of the brain waves. It's associated with states of peak focus along with expanded consciousness. So they found with like long-term meditators, Tibetan monks who've been meditating for 12 hours a day for years, looking at their brain scans, there was actually a series of studies that Dr. Richie Davidson from the University of Wisconsin looked at the brain scans of these advanced meditators, and they were looking at this exact same EEG technology and seeing what's different about their brains versus a non-meditator. And one of the most significant things that they found was that meditators had greatly increased strength of their gamma waves. So they kind of linked that to that expanded consciousness, increased awareness that meditators frequently report. And that's something we also know that psychedelics, breath work, meditation, all of these tools will facilitate increased levels of gamma. And gamma really drives neuroplasticity, enabling someone's brain to change and rewire itself by helping new connections sprout up, new neural networks that normally may not be communicating too much with each other. Gamma facilitates the connections between a variety of different networks in the brain. If you've ever seen, there's a great image where it's sort of showing like baseline connectivity of someone's brain and then their connectivity of their brain on psilocybin mushrooms, and showing like the lines just go all over the place, like showing how that's really what's happening in a psychedelic state is there's all this increased connectivity. So people are perceiving the world entirely differently because all these different areas of their brain that are not normally connecting start talking and working back and forth with one another. So those are the 5 major brain waves that we assess with the brain map. And then based on that, along with what someone's symptoms are, along with really what their goals are, whether they're wanting to improve things like their focus and productivity, or if they're more so looking to manage stress and just be more even keeled and less emotionally reactive. I take all that into account in order to put together a personalized neurofeedback protocol. So, going back to what I was saying about the importance of doing the brain map first, once we actually know where someone stands as far as each of these 5 brainwaves, we can then go about putting together a specific protocol that's going to be best suited to each individual.
And I know you said anything over 20 hertz is considered high beta. What's the full range for beta? It goes
Beta
from
is
what to,
about 13 or 12 or 13 to 30 hertz.
okay. And is so with circadian rhythm and diurnal rhythm, like with cortisol, we want it to be highest in the morning, lowest at night. Is there a diurnal rhythm for the different brain waves?
It's a great question. So when someone wakes up, they're kind of in a theta state because they're sort of still in that drowsy, dreamy sort of state.
Mhm.
And then when someone's falling asleep, they start, when someone starts getting drowsy, they'll start producing more alpha and then eventually, more theta waves too. So there definitely is, as far as a rhythm, as far as that goes, if we find ourselves just getting really drowsy during the day, our brain kicks up and ramps up its production of those slower alpha and theta waves. When we are more so, if we drink a cup of coffee in the morning and we're at a state of heightened alertness, we'll have an increased production of those faster beta waves. So there is definitely variation as far as with the circadian rhythm, and we'll also see an even greater, crazy changes that'll be seen in a couple different specific situations. The first would be women's menstrual cycles. There'll be very, significant changes in their brainwave activity. And the second would be bipolar disorder. When we look at someone's brain in a state of mania versus hypomania, it looks like you're looking at 2 different brain scans, or 2 different people. So other than that, there tends to be pretty accurate replicability. Like they've measured about 98% replicability. If you were to do a brain scan, this morning, and then you tried doing another one later this afternoon, about 98% of the data on average would be the same, but there is a slight variability, due to things like circadian rhythm.
Awesome. And, nootropics have exploded onto the scene. A colleague of mine, Ward Dean, he's a medical doctor down in Pensacola, Florida, but he co-authored the book Smart Drugs. Um,
I, I'm looking around for, I literally have that somewhere on my bookshelf
you
here.
have it?
Yeah.
Yeah. And so, I started reading that, way back in the day. We're talking 2007. I was taking Huperzine A, things like that, after reading his book. And I know him, I met him in person. But my question is, if you're doing neurofeedback training with someone and they're on, let's say, lion's mane or methylene blue, do you tell them to stop for the brain map so you can get an accurate baseline and then do some training with the nootropics, or how do you do that?
It's a great question. I'd say for the baseline brain map, I try to get people just on their normal routine. So if people have been taking lion's mane and methylene blue for, several weeks or months, that's just part of their routine, then I don't have people go off of it. Now, what I do advise against, if someone's not normally a caffeine drinker and then they have a double shot espresso immediately prior to the brain map, that's going to skew the results. But if someone normally has a morning cup of coffee, and then, the day that they do the brain map, I'll still have them, I won't have them make any changes to the routine, because for things like caffeine, there can actually be some withdrawal effects. So even though you're trying to think, oh, okay, let me get the brain at a baseline state, but actually if you're having people come off of something that they're dependent on, like caffeine, if people are daily coffee drinkers, you're actually going to get a skewed data set. So just trying to
Absolutely.
maintain as much routine, getting good quality sleep the night before is really essential, just in getting the best accurate data that you can.
Yeah, one thing I've been studying a lot the past 3 years is upper airway resistance syndrome. And I have moderate sleep apnea myself. So I've had night lays, which is a laser they use on the posterior tongue muscles, keep it from sliding down the trachea. And I have an oral appliance. But, you know, you're not going to get deep sleep if you have upper airway resistance or you're a mouth breather. And the problem is, you know, a lot of people have jumped on the bandwagon of taping their mouth, but you have to stop and ask, well, why are you breathing through your mouth and not your nose in the first place? And sometimes it's just creating awareness, but that's pretty rare. A lot of people don't have nasal patency. And so, because they can't breathe properly through their nose, they have to breathe through their mouth. But if you go taping their mouth shut, and then they can't breathe through their nose, that could create a lot of damage. I mean, you know, sleep apnea, upper airway resistance syndrome increases the risk of heart attack, stroke, Alzheimer's, erectile dysfunction. The list is a mile long. Have you tested people prior to getting their sleep apnea and upper airway resistance syndrome addressed? Have you tested them prior and then after to
That's a
see
great
changes?
question. That's a great question. I actually haven't, but I would definitely see that as something that if someone did have sleep apnea, the neurofeedback training probably would not work nearly as well, if at all, if there is some underlying, medical issue where people are just not getting restful sleep. They're definitely going to need to address that before actually benefiting from something like neurofeedback.
Absolutely. And so I know on Instagram, I've seen you like you had the intranasal light or laser. I think you had a cranial electrical stimulation device on once.
Yep.
Can you talk about those different appliances and devices and which scenarios are most appropriate for which devices?
Definitely. So, yeah, basically, neurofeedback is the most common and popularized out of all the different neurotechnologies, I would say. But there's some other ones that work really well. I really am a huge fan of a technology called brain photobiomodulation, which is a mouthful, otherwise known as red and infrared light therapy. So, there's different devices like you mentioned like the intranasal unit. So, there's these probes that you can actually stick into either nostril and it shines red and infrared light, which basically irradiates the blood, causes increased blood flow and oxygen, will actually cause hypoxic or low oxygen cells in the brain to release nitric oxide, so increasing vasodilation, increasing blood flow and oxygen to the brain. It also downregulates various different pro-inflammatory cytokines. You're getting neurogenesis and synaptogenesis, so the growth and creation of new neurons and new connections amongst those cells. And then just the mitochondrial benefit of increased cellular energy. So I really think red and infrared light therapy is hugely beneficial. It's actually something I work with clients a lot, utilizing it immediately prior to doing neurofeedback training as sort of like almost like a pre-workout for the brain, where
Like a
it's
primer?
increasing a primer because it's increasing energy production. And then neurofeedback is a very energy demanding process where we're asking the brain to make these changes to its electrical functioning. So it actually, like anecdotally amongst colleagues in my field, I had heard for several years of people utilizing them in conjunction. And now there's actually starting to be some research studies that are confirming that that anecdotal report that it actually can really enhance someone's results. So it's been studied for conditions ranging from, I know they've done anxiety, depression. There's been a lot of research looking at traumatic brain injury, as well as like headaches and migraines. So there's a lot of versatility there. There's different devices, like there's the intranasal probes. There's also a headband device called the Sarah Thrive. It's actually just, I think, about to get released to the mass market. But I like
Sarah
that.
Turner?
Yeah, Sarah Turner.
Yeah.
Yep. So it's specifically, a prefrontal kind of band. And then they also make the full helmets. There's a Neuronic. I have a couple of those helmets that I work with clients on. The helmets can tend to be a bit pricier. And for people who have a lot of hair, it can actually limit, the penetration of the light. There's debate as far as how deep it can actually penetrate. So I really like the intranasal as just like an at-home option. It's not as expensive as the helmets. And for a lot of people, I think gives, still the same, if not even more beneficial results. So I think that's probably my favorite form of photobiomodulation for the brain is the intranasal. And then as far as some other technologies, so there's neurostimulation, basically passing a very low intensity current of electricity through the brain is actually has a whole host of benefits. So it's not nearly as scary as it might sound. I know people, whenever they hear neurostimulation, they might start thinking, 1960s, one flew over the cuckoo's nest,
Cuckoo's nest.
electroconvulsive therapy. So that's kind of the very crude, elementary version of neurostimulation. It's since been refined quite a bit. So just to give people reference, the neurostimulation that I utilize with clients is somewhere between 1 to 2 milliamps of electricity, whereas electroconvulsive therapy is somewhere upwards of 600 to even 700 milliamps of electricity. So it's a huge difference. Mild electric stimulation has been shown to increase blood flow and oxygen, as well as increase the production of more serotonin, more norepinephrine, actually release endorphins in the brain, so being really helpful for pain relief. So there's a lot of benefits to neurostimulation. You can also alter the frequency. So same deal with the infrared and red light. You can pulse the light, and you can also pulse the stimulation at whatever frequency you're wanting to entrain. So if you're wanting to put someone into a really focused state of alertness, you can do a 20 hertz beta rhythm, versus if they need to, if you're looking for more relaxation or deep meditation, you can more so target alpha or even theta frequencies. So it's very versatile in terms of the effects that someone's getting. There's sort of the effects from, say, the neurostimulation or from the red and infrared light. And then there's also the frequency specific effects that you're getting depending on what frequency. So for instance, like gamma, there's a lot of research with specifically the infrared light looking at being able to break up amyloid plaques, beta amyloid plaques, with that 40 hertz frequency of pulsed light. So there's a lot that we still don't know as far as the different frequencies and what might be best for different conditions, but it's definitely plays a big factor in addition to just the technologies themselves.
Let's talk for a couple minutes about binaural beats. Can you tell us what they are and how they factor into the work that you do, if they do?
Yes. So I've worked actually binaural beats were one of the first things that I tried in just training my own brain back several years ago. I started reading about them through Holosync. Bill Harris, talks about, he had I think he's passed away, but he had a binaural beat program, and I really benefited from it, taking you through so basically through the use of these sound tones where you listen to them using studio headphones. So there's a specific frequency that's getting sent to the left ear, a specific frequency that's getting sent to the right ear. And basically I'm not a specific expert in binaural beats, but my understanding is the difference in terms of those frequencies is what the brain will then entrain to. So if you have 100 hertz or 100 hertz frequency going to the left ear and 80 hertz going to the right ear, the difference, the 100 minus 80 is 20. So the brain will then train to create that beta pattern. So you can do a whole lot with binaural beats. I know Andrew Huberman recently was talking about 40 hertz binaural beats being really helpful for focus and memory. And then, you can definitely take yourself into those deep meditative patterns. That's what Holosync does by really taking the brain through that full spectrum down from beta into alpha and theta, and even into the depths of delta. So I think binaural beats are definitely a legitimate technology. What I can't vouch for necessarily is the efficacy of if people just go on YouTube and search in binaural beats. You can't necessarily know, you can't just like hear the binaural beats and know that it's actually accurate. If it's saying whatever sort of frequency, you can't really verify whether you're actually getting that. So
right.
I think that kind of maybe tarnishes the technology itself. Whereas, reputable companies that make binaural beats, I think it can definitely be used successfully, but I definitely cannot vouch for the efficacy. I'm sure some of those YouTube tracks do work, and others might not as well.
And have you experimented with devices like BrainTap, Neurovisor, things of that nature?
Yeah, I have tried out the Neurovisor. Someone at the biohacking conference in Orlando a couple months ago gave me a demo of that one, and it was definitely an interesting experience. It was almost like a kind of like a light psychedelic sort of experience. Like he
Mhm.
told me it was going to be like a whole ayahuasca journey. I've never done ayahuasca before, but he yeah, he kind of hyped it up, and it was definitely cool. It was definitely an interesting experience. I've only tried it that one time, but I definitely want to learn more about it and potentially, utilize it more with clients. And as far as brain tap, I definitely have utilized those devices. It falls under the category of audio visual entrainment.
Okay.
So, in training the brain through the use of light and sound, there's actually a different device that I actually prefer, a much lesser known about device called the David Delight Pro from a company called Mind Alive. They manufacture a similar sort of device, but it also has a couple electrodes that come with it that deliver the alternating current stimulation on the ear clip. So you're getting the neurostimulation in addition to the audio visual entrainment. And it also tells you specifically the frequencies that you're getting. That's one thing, like I'm very it's very much a red flag to me. But whenever any company says like proprietary formula or proprietary
They won't tell
frequency,
you.
it's like I don't really trust it, and also have a hard time, being a neurophysiologist who wants to be very specific of, training, helping someone train specific brainwave patterns. If you don't know specifically what you're getting, then it can be more challenging. Versus what I really like about the David Delight Pro is there's different settings. You can specifically do, a higher frequency in the left hemisphere versus the right. You can do there's a lot of very specific settings, and Dave Seaver is who's the founder of Mind Alive, has done a lot of the pioneering research in the field of audiovisual entrainment since like the 1970s, I think. So I really like that company. But the basic technology, audiovisual entrainment, is definitely very, very sound, and I think can be used in conjunction with neurofeedback training. Some clients of mine prefer it, compared to neurofeedback. Some people feel like they get better benefits just through utilizing neurofeedback. But in
Okay.
my programs, some of the programs I offer people, I'll actually combine and stack together. They're getting the neurofeedback alongside one of these David Delight machines. So it's just another tool, in your toolkit. So I think it can just accelerate people's progress as they go through neurofeedback, or if they're just wanting to utilize it on their own.
And when would alternating current versus direct current be more appropriately used?
Right. That's a great question. So basically, just to break down for the listener, so direct current versus alternating current. So alternating current is more producing an entrainment effect where you can make it frequency specific. If you're trying to put the brain into, say, an 18 hertz beta rhythm, you can do that. Versus direct current is more so just passing electrodes from the anode to the cathode. Or sorry, the cathode to the anode, the negatively charged electrode to the anode, the positively charged electrode. So you're basically, sending electrons in a certain direction. The anode is the stimulating electrode. So wherever you place that on the scalp, that's going to increase blood flow and oxygen, causing a calcium and sodium ion surge in the brain, resulting in neuroplasticity. And then you're also going to get at the cathode, the negatively charged electrode, you're going to get a production or a release of GABA, the main inhibitory neurotransmitter. So I really like that when there's specific areas of the brain where you're trying to excite and other areas you're specifically wanting to calm down. You can be very precise with it. And it's actually a tool. There's been some amazing research that a lot of people don't know about, but with direct current stimulation, there's a specific protocol that's been very well studied, or a specific montage, which is basically the placement of where you're putting the electrodes. So there's a specific montage where you have the right, basically the cathode, the negatively charged electrode at the right prefrontal cortex, like right there, and then the anode at the left frontal cortex, about there, for people watching on video. And it's basically with that protocol, they found that it's reduced people's depressive symptoms by about 60 to 70% within 3 sessions. So, I mean, I think that's pretty remarkable in terms of the duration of time needed. Well, only 3 sessions, and I think it was 80% of the people in the treatment group showed that significant of an improvement. So I think that can be a great, solution specifically for people who have had, treatment resistant depression, who maybe tried and failed different antidepressants, or maybe even they've tried ketamine and that hasn't worked for them. I think direct current stimulation can be an amazing option. The alternating current, I just think of as a lot more frequency specific, and you can kind of do a lot more specific work with it.
Absolutely. And to touch on, you mentioned depression several times. If I remember correctly, the default mode network is the only or one of the only areas in the brain that increases its activity during a depressive state. With one of these devices, whether it's neurofeedback or transcranial direct current stimulation, do you see the default mode network decreasing its activity?
You can see certain hubs of the default mode network where you might be training the brain to reduce activity there. So the default mode network that kind of forms our sense of self, the stories we tell ourselves, how we conceive of ourselves just in the world. That oftentimes when people get depressed and they get entrenched into those negative patterns and negative stories, that they're telling themselves, that's oftentimes the default mode network really activates. And then a tool like psychedelics or sometimes neurofeedback can go and really reduce activity there, which can really help people, reformulate and repattern their brain. So get them out of those entrenched kind of patterns. I like to think of it like, there's the ski slope analogy for neuroplasticity, where if you're skiing down a ski slope a bunch of times, there starts to be a lot of tracks. In the same way, if we think the same thoughts and do the same behaviors, we start going on autopilot and just repeat the same negative patterns oftentimes, like people, who want to try to break habit or addiction, find it very difficult, or people who have like a New Year's resolution, right? We know that the majority of people, they're going to start going to the gym every week, for a week or two, and then they're going to fall off. Habit and behavior change is extremely difficult because the brain gets into those hardwired kind of ruts. In the same way, going down the ski slope, there's going to be those grooves, those ski grooves. So I like to think of something, neuroplasticity as like a fresh blanket of snow, where you suddenly have this opportunity to forge these new neural pathways and go down new sides of the mountain that haven't yet been explored. And that, I think, is really when you quiet down the default mode network, you allow the brain to have an opportunity to really repattern itself. So it's definitely something that can be assessed through the use of brain mapping, and then specifically we'll sometimes work specific hubs of the default mode network with neurofeedback training.
Patients and clients who have mold toxicity, systemic stealth pathogens that some of them are neurotropic and like to live in the myelin sheath. And, the brain forms these limbic loops. And that's the basis of things like dynamic neural retraining system, the Gupta training. Do you have any experience with that? And what role could neurofeedback play?
I actually don't have experience. I need to look into those more because I've had some clients ask me about those. I honestly can't really speak too much on them. I should definitely learn more about that. But I definitely think that, a lot of these things can be very synergistic. So I think neurofeedback is not at all the be all end all for people. I think it can be a powerful addition to other things that people might already be doing, other technologies, other methods, other programs that they might already be doing. It can just enhance the efficacy by stabilizing the underlying brainwave patterns. But yeah, I'm not at all opposed to other methodologies that I think can also work really in synergy. There's really nothing that's going to be contraindicated with neurofeedback. Even people taking psychiatric medications, neurofeedback can sometimes sensitize the system. So people start feeling the effects of the medication more and maybe actually have more side effects because
And they
their
have to go
system,
down on the dose.
they go down on the dose. But in terms of neurofeedback, you're able to combine it, with whatever other sort of intervention. So yeah, it can definitely be used in conjunction with a lot of things.
What's something that you know today that you wish you would have known, say, 9 to 10 years ago?
Hmm. 9, 10 years ago. Well, I'm today 26, so thinking back to, my 16 or 17-year-old self, I feel like that was when I was in the midst of, dealing with pretty severe social anxiety back in high school. And I thought that that's just, that was like always the way I experienced the world, just growing up with social anxiety. And it was something that really paralyzed my ability to form healthy friendships and meaningful connections. And it made dating pretty much damn near impossible, back in high school and college. And I think I very much viewed it as like a moral failing, like I just wasn't trying hard enough and I just couldn't figure it out. No matter how much therapy I tried going to, I just wasn't making progress. So for me, what really cracked the code on that was the combination of some psychedelic experiences like MDMA, along with neurofeedback training, really changed the game and really allowed me to shed all of really my social anxiety, which really was composed of like I could never think of the right word to say. My verbal fluency was really off.
Mhm.
So I found with the brain map that a specific area of my left frontal lobe that's really important for verbal fluency, that area was very underactive in the beta frequency. There was a lot of low activity. So with neurofeedback, I was able to directly train and improve activity there and saw like my verbal fluency skyrocket, and which caused me to then feel so much more comfortable and confident in social situations. So really what I would say there is that no matter, I would tell myself, my younger self, that the issues that you're facing today are the result of the way your brain is functioning on a biological level. But that is something that is not, I don't believe that anyone at a very deep core level, I don't think that someone is like an anxious soul or a depressed soul. I think that these are all symptoms that we struggle with due to the functioning, the biological misfiring of our brain, whether that's from past, physical or emotional trauma, whether that's from mold toxicity, heavy metals, all these things that you know a lot more about than I do. But regardless, the brain is not functioning as well as it should be on a biological level. And that's why people experience different issues. So if I could just tell my younger self one thing, it would be, fix the biological problems within your brain and your life will become a million times better, which is what happened.
Absolutely. Yeah, between undergrad and my doctorate program, I originally was going to get my doctorate in psychology, a PsyD. And so I took, I think, 10 different psychology courses. My favorite was a physiological psychology course because I got to combine the science with, more of the theory.
Yep.
But I think it's really sad and unsettling when I hear psychologists, especially, tell people, or I get a client or patient who's been to a neuropsychologist and they're told, "Oh, you have this learning disability," but you could take the smartest, kindest person in the world, you put some mycotoxins in their body, some heavy metals, some stealth pathogens, some gut dysbiosis, you eat a crappy diet, you don't exercise, and then we get labeled, "Oh, you have anxiety. Oh, you're an underachiever." Well, no one wakes up wanting those things in the morning. I mean, I've never met anyone who does. And so that's the issue I have with traditional cognitive behavioral therapy. "Oh, how do you feel?" "Oh, you're not sure? Okay, I'll be $250. Come back next week and I'll ask you again." And around we go. And then, 2 years goes by and you made like incremental progress at best. So I think what you're doing is great. It puts, the client in the driver's seat as the CEO of their own health. And that's essentially what all of functional and integrative medicine is about.
Yeah. Yeah. I mean, I totally agree with you that I think it for people who haven't necessarily experienced some kind of, because like they say that, 25% of the population has the the genetic variant where they can't clear mycotoxins from the system, right? The HLA-DR variant, which I found like you had that too. Yep. Yep. So, 75% of people might be in a room full of mold and they might not experience too many issues, where you and I, we feel our brain just get wrecked, right? So I think people who might, for just, their purely genetic reasons, or maybe they just lack of environmental exposure, maybe they've always feel like they're just running at pretty high performance, and they might not really understand, without firsthand going through some of these experiences, what can actually happen when there's these biological problems. I think honestly, a lot of the practitioners out there, I mean, I feel like if you're a psychologist or neuropsychologist, and you actually have had a firsthand experience with mold or with heavy metals or gut dysbiosis, like you're gonna have a level of empathy and understanding for other people's issues that I think if you hadn't gone through that same thing yourself, I mean, I don't know. I mean, that's what I really wonder is, for people that strictly focus on the psychological side, have they just always had kind of perfect genetics, perfect biology? Because when your biology starts misfiring, like you could go to all the best therapists in the world and speak to them all day, and you're still not going to feel better.
Absolutely. I mean, you can't out-talk mycotoxins, heavy metal toxicity, hypoperfusion to the frontal lobe. I know why people don't do it, because of the training and the pharmaceutical companies funding medical schools and doctorate programs. But I think the work that you're doing is incredibly important. We're going to put up your link, your bio. What's the best way to reach you? Is it through your website? Do you have a contact form?
Yeah, people can contact me. The website www.neuroflex.tech, TECH is the website, but people could probably access me most easily on Instagram at Neuroflex is my tag. I'm super responsive on there, so I'd be happy to continue the conversation. If any of your listeners have questions or comments on the episode today, I'd be happy to chat with people. So just hit me up on Instagram at Neuroflex, and would be happy to hear people's feedback.
Well, awesome, Toby. Keep up the great work, and hopefully we can have you back on in the future.
I'd love to. Thank you so much for the opportunity, Tim. I really, really appreciate it.
Absolutely. Take care.